We're going to spend some time now in this lateral view of the skull to look a little more at the temporal bone. So remember, TMJ is formed by the articulation of the mandibular condyle and the mandibular fossa of the temporal bone. Let's go ahead and take this away so we can see the temporal bone a little better. So from this lateral view, the main landmarks we see of the temporal bone are going to be this big opening here. This is our external acoustic meatus. So normally an ear would wrap around like this. We have the ear canal, and that opening externally is called the external acoustic meatus. Mastoid process, if we think about where the temporal mandibular joint would be, get it back on here. There we go. So the mastoid process is going to be just posterior to that joint. So it's this big process here. We typically have a styloid process as well. So that's going to be this needle-like projection that you see a little more medially. They may be broken off when we look at skulls next week, but this one has a really nice pointy styloid process. And then lastly, we have that mandibular fossa. So we already talked about that, but it's going to be this big opening here, just above the styloid process and just anterior to that external acoustic meatus. And then lastly, we have our zygomatic process. So going back to the cheekbone, we have the temporal process of the zygomatic bone, and in this case, this is called the zygomatic process of the temporal bone. So always remember which bone are we starting with, and then name your process from there.